Can endurance training have any negative effects on your gut? Find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello and welcome to Digest This. I'm Dr. Liz Cruz and I've got Tina Nunziato sitting right here by my side. Thank you for joining us. If you're a first-time listener, we welcome you. We're so excited you're here. If you're one of our regular listeners, we welcome you, we love you, and we appreciate that you take the time to hang out with us every week for 15, 20 minutes. So today we have a guest. And she was actually a guest on our podcast at the end of June. So not too long ago, just a few weeks ago. Her name is Martha Carlin, and she is the founder of the Bio Collective. And so at the end of June, we did a podcast with Martha on how the food supply affects the microbiome. And it was fascinating. Martha's husband was diagnosed with Parkinson's, and Martha's passion has been trying to research and try to figure out, how to keep her husband with her for the rest of their lives together. And it is truly a work of love that the journey that she's been on. And so it was such a great episode that we did with her, and we got such great feedback. We wanted to bring Martha back. And so we have brought Martha back today. And Martha, welcome. Are you there? Hello?
Oops, sorry.
Oh, okay.
I had the mute button on. Thank you.
Awesome.
It's great to be back with you.
Good to hear your voice.
Good to hear your voice. Yes. So today Martha has a fascinating topic because I think it's something that is such a trend, is this endurance training. I mean, we have one of our own kids. He's our son. Our oldest is 27 years old, and does a lot of endurance training.
He's a bodybuilder.
He is a bodybuilder, and we have a lot of patients that come to see us, and so it's just the big thing. And so, Martha, we are fascinated and intrigued to find out more about your journey and doing research into the effects of body training and how it affects our gut and can lead to other things.
Well, it's kind of an interesting time also to be talking about this because it is the Tour de France.
That's right,
and,
the Olympics time.
John is also a cyclist,
awesome.
But he was a marathon runner.
Oh, wow.
And just in watching these cyclists and what they really have to do to their bodies and the amount of calories that they have to consume, they convert themselves into sugar burners, carb burners. Although, there are some changing training methods now that try to work more with the different dietary things. I haven't seen any of that talked about on the Tour de France, but I always had a question in my mind if John's marathon running had any effect on his getting Parkinson's. Mm-hmm. And over the years, I'd run into a number of other people with Parkinson's who were also some form of endurance athlete. Mm-hmm. And then a couple of years ago, I got connected to Dr. David Minkoff, who is the Perfect Aminos founder, and he's a marathoner, Ironman, and we were talking about insulin resistance because he has insulin resistance despite all his healthy lifestyle and everything he does. Mm-hmm. And so I started digging back into, what's going on with the microbiome of these endurance athletes and this, conversion to sugar burning and also what happens with a leaky gut. Mm-hmm. So in recent years, there is research showing what happens is as you're kind of pushing your body and creating inflammation, it opens up the tight junctions of the gut and allows endotoxin to cross over and create this inflammation. And as I started to talk to more athletes about kind of what goes on after they do a big race or something, they often have a crash or will get sick or something. So you set up these patterns in the microbiome of converting yourself to a sugar burner, opening up the tight junctions and letting these inflammatory compounds come through. And, eventually the body may not be able to recover as quickly over time. So it's been a really interesting learning process for me, because I have another young onset Parkinson's person that I talk to a lot who is a distance runner, and she loves the distance running. That it makes her feel good. She feels better. But she also knows now it may be contributing to her disease. So, it's kind of a dilemma of, okay, where do I balance out my love for, pushing myself athletically, for taking care of, my body.
And where have you found is that balance? Like, I mean, obviously she still can run, but maybe the diet is just different, or maybe she doesn't run as far, as long. Like, what have you found is the right combo there?
Well, I think she's still really working through whether she's willing to give up the distance running or not.
So do you feel like she would have to completely give it up to not have her issues?
Well, I think once you are in an inflammatory state like Parkinson's disease, continuing to do something that opens up those tight junctions and lets more endotoxin into the system is probably not going to be beneficial until you can assure that you have fully healed the gut. And, I don't know, at a young age, maybe it's possible to turn back the tide on your symptoms. And, we certainly saw that over the years with things we've done with John that have improved. And he stopped the long distance running about 2 years after his Parkinson's diagnosis. Now, he did go on to do biking, but the level of intensity of his biking was much less physically taxing. And the interesting thing is there is actually evidence in Parkinson's that cycling is the first exercise that's been studied. They're starting to study some other things, but cycling at a specific cadence in RPM for 3 times a week, minimum 3 times a week, for an hour, could actually reverse about 35% of the symptoms. There's definitely a need for exercise, because exercise is improving the mitochondria and oxygenation and that sort of thing. But pushing the body to these extremes over a long period of time, if you're an endurance athlete, for a lifetime, as an example, John was a endurance skater. He did distance skating, speed skating, and then was a cross-country runner all through high school.
Oh, wow.
So, many years.
A lot of endurance. A lot of endurance training,
a lot of pushing the body without, probably not a lot of breaks.
Yeah,
Right.
And I guess, to like what Tina was asking you, like, so, how do you determine how much? Because, we have a lot of, for all our listeners out there, what would you consider to be too much, too little? Like, where's the happy medium? And then the other thing is, like, how do you even measure that, right? Like, this inflammatory state, because even our diets could put our intestine into this inflammatory state, where the tight junctions are loosened and you have toxins that are going through the intestine. That's why we're always like so big on promoting, getting the gut back to healing the gut, the probiotics, the detox that we have. And so, how do you measure that, and what do you consider to be good? I don't think like I'm thinking to myself, oh, good, being an
I don't have
endurance
to
trainer was
exercise
never
now.
my issue, and wow, maybe I shouldn't be exercising.
No, I mean, I think you have to
Well,
You
exercise.
do have to,
It's
yeah.
interesting. I'm certainly not a proponent of not exercising.
Right,
I mean,
right.
I walk between 3 and 5 miles a day,
Yeah.
but I walk at a fairly moderate pace.
Mm.
There is actually a neurologist named Dr. Michael Phillips he's in Australia. He's an American, but he practices in Australia and does research over there. And he's doing a lot of research on diet and exercise in neurological problems. And, he's actually doing research on eating once a day and not doing any strenuous exercise, but doing like resistance training, physical resistance training. But, then, we are friends with Dr. Alberts at the Cleveland Clinic, who's shown the benefits of the cycling in Parkinson's. So, I think
There's so
it's
many.
still very early
So many
in
different things.
understanding
Yeah,
that, but there is a you can get a blood test of serum lipopolysaccharide, so serum, and that will measure endotoxin level. I don't know how
Lipopolysaccharide.
easy it is to get it, but that's actually a test that we did in our diabetes clinical trial with our Sugar Shift probiotic, was measuring serum endotoxin or serum LPS to see if that was going down over the course of the clinical trial, because endotoxin, so that is crossing through this leaky barrier, is actually used in many disease models. So in these animal models, there's a depression model using endotoxin, a Parkinson's model, a diabetes model. There are numerous cell models where they create inflammation with LPS. So I think it's really an underappreciated contributor to our overall health problems, and the exercise, opening up that barrier and letting it across, is just kind of one piece of that puzzle, because you have to have those endotoxin producing bacteria already there.
Right.
So, what the work that you do for, helping people to improve their gut lining and their overall gut health is really what people need to be focusing on.
Amen, sister.
Amen. Awesome.
Oh my goodness. There's just so much. I don't realize how much happens in the gut that affects the whole body and all the disease states that we're being, that we're being exposed to.
And our poor bodies, right? Because, people that do endurance training,
they're trying to be healthy.
Yeah, they're trying to be healthy, and yes, they're maybe going a little overboard. Like we've told our 27-year-old, like, hey, you need to
slow down.
Slow it down. Your legs are the size of our hips.
He's like the Hulk.
Yeah, but they're trying. They're trying to be healthy, and it's just a lot of great information what you've just shared with us.
Yeah.
Well, I also had a really interesting conversation. It's probably been 4 or 5 months now, but I got a call from a customer, a Canadian biathlete. So I think she might have been on the Olympic team. And she was trying to address her insulin resistance. And we had this really interesting conversation about the period of time when she was training for the trials and the type of food her coach had her eat, which she knew wasn't healthy. But there's still a lot of coaches using these, glucose, fructose, high rapid access energy sources, for their athletes and training.
Yeah. Yeah, I can't tell you how many consults I do with bodybuilders, endurance athletes, because their gut is so messed up. So it makes a lot of sense what you're saying.
Absolutely.
And appreciate the research behind it, right? It's like we can talk all we want about, this is what's happening, but to know that there's research behind that and that this is actually truly what is happening is very helpful.
Yes.
Well, it's just, it's something for an endurance athlete to at least think about and, give thought to resting and healing appropriately, certainly between events and between training for events.
Absolutely. Yes. Thank you so. I mean, one of the huge takeaways for me from our podcast with you right now is the whole connection of this endurance training and leaky gut. I mean, I didn't know that. And so that's major. And like Tina said, we're seeing these patients that are coming in, these endurance trainers, these athletes with all of these issues. And I know that I have thought at times, like, you're the last person I would expect this from. You're supposed to be healthy.
Yeah.
So
they look good on the outside.
Right.
They look good on the outside.
Yeah.
But they definitely don't
feel.
feel. Yeah, they definitely don't feel good on the inside, for sure.
Yeah, so thank you so much for enlightening us. We really appreciate it, and we're so happy that you've taken the time to be on another episode with us. Thank you so much.
Well, I appreciate you having me back.
Yeah. And we'll reconnect, because I know there's a lot of topics that you have, and we'd love to learn more about the research you've done and how it affects the body. So we'll definitely have you on, and we'll wrap up this podcast. Just give us a second, and then we'll come back on with you.
Great.
All right.
All right. Well, thank you for joining us. And if you'd like to connect with us, because we would like you to connect with us, we'd love to connect with you. You can find us on our website. There's a magenta colored button on the homepage, drlizcruz.com. You can click that and schedule a free 30-minute wellness consult. And it's free, and it can be done from anywhere because it's done over the phone. If you haven't rated us, please give us a 5. I always love when she puts up the 5, because it's going to help other people just like you to find us faster. And we have so many amazing topics. You can't miss these. And so that brings me to the last thing. If you haven't subscribed, what are you waiting for? Please subscribe so that you never miss an episode.
We've almost hit 450 podcasts back.
Woohoo! Thank you so much for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.